main thing that I see to try and adopt digital imaging into mainstream pathology is that people at the highest level really have got to recognise the potential that it provides. And some of that is not just about the benefits, but how it will protect pathology service against some really, really significant risks.
What I have learned from using digital pathology over the years actually is how receptive people are to using the technology once they see it. I think the challenge sometimes is getting them in front of the technology and showing them what it can do.
If we can show that this is actually a key step that needs to be integrated into our workflow to allow us to be efficient in many more other ways, then this would help.
I think what needs to occur most importantly is change in the mindset of pathologists, that they must be able to trust and believe the images, and they need to have the confidence of making that correct diagnosis based on images as they have been traditionally doing on glass slides.
Digital pathology in the next 5 to 10 years, I think, will become quote-unquote mainstream. I think that as we move towards personalized, predictive, preemptive medicine, we will need these tools in our toolbox for safe and effective patient care, and digital pathology will be an enabling technology towards those healthcare modalities.
I think in the next 5 to 10 years, as far as using digital pathology as a tool to collaborate, it will really take off even more than it has.
I don't know how far the NHS will go for a widespread embracement of this digital pathology, but I think the private providers in rich countries, they should be able to fully integrate digital pathology in their reporting.
Provided we can convince our own NHS leaders and cancer leaders that this is actually a must-have, then I think there will become a tipping point where all of a sudden it's something that every trust will need to have. There are various academic papers that have already shown that cancers can be graded more accurately, and in doing so the therapies that are then provided to the patients can be far more appropriate.
I think for the adoption of digital pathology to become mainstream, the solutions have to be scalable so that we can get the cost per slide down to a price point where there is an incentive to use the technology rather than a disincentive.
We need a very integrated workforce that has fully embraced digital pathology with the use of algorithms that removes some uncertainties and some inconsistencies that are between and within the observers.